Hello and welcome to Step 2, Case Report Structure. In its first part, I want to explore the fundamentals of a case report structure. This step is probably the most important one for you because once you understand the structure of the case, everything falls into place. Once you understand the major headings of the case, then all you need to do is fill in the blanks. In a scientific format, a case report has the following structure. 1. We have an abstract. 2. An introduction. 3. The case report itself, which has 3 subcategories: the assessment, the intervention, and the results. Then the discussion, a conclusion, figures and tables, and the references. So let's delve deeper into each one of those. In the abstract, essentially, the objective of the abstract is to summarize the main points of the study. So you want to report in there the purpose of the case report, the basic procedures that were followed, the main findings, and the principal conclusions. The abstract has its own structure, and it usually includes its structure along the following lines. 1. Objective or purpose of the study. 2. Clinical features. 3. Intervention and outcomes. 4. Conclusions. And 5. Keywords. Here you have an example from my own case study on quality of life improvement and spontaneous lifestyle changes in a patient undergoing subluxation-centered chiropractic care. You see that the abstract summarizes the whole study and has its own structure. So use that as a template and an example to structure your own abstract. This whole study, you can download it for free. It is right below this presentation. Let's now look at the introduction. In the introduction, you want to state the health problem and its significance, the prevalence, incidence, morbidity, financial and social cost. You also want to review the prior literature on this problem and its usual treatment or intervention. So for example, let's say you've decided to report on the great benefit that someone suffering from migraines had undergoing network spinal analysis. You may want to do a literature review and talk about the prevalence and incidence of migraines, its causes, the pathophysiology, and how it is usually managed in the medical field, like for example with drugs, and in the alternative field. As part of the introduction, you also want to indicate why this case study is important and how it will contribute to further understanding. For example, you took care of a patient with a rare type of disorder, or it's a new approach to taking care of people, or you've made an interesting observation of a phenomenon, or just because there's been no prior report in the scientific literature. You may be the first one to report on the benefits of network for digestive problems, for example. One of the things you want to is to clearly state the hypothesis of your paper. So for example, in mine, in the quality of life improvement study, I basically reviewed the literature that was related to chiropractic care and how it improved quality of life, but I also set up the hypothesis that people under care make spontaneous lifestyle changes and that I wanted to report a case on that. After the introduction, we go in a case report, and as we said, there are 3 parts to it: the assessment, the intervention, and the results. So let's look at the assessment. In a case report assessment, you want first to start describing the patient's demographic characteristic: age, gender, marital status, income level, for example, so forth and so on. You also want to explain how or why the patient presenting to your clinic, how it was referred, for example. Clearly state the patient's presenting complaint or reason for coming in for care. Did they come on referral for taking care of a specific health condition, or did they present for overall health and wellness enhancement? Then you want to describe the findings from the history. So for example, if someone come in with migraine headaches, you want to talk when that first occurred and how long the patient had that problem for. Describe other signs and symptoms that are associated with it that are apparent to the patient. Describe the prior medical diagnosis, the treatments that have been received, and how those treatments helped or didn't help the patient. Then you want to go and report on your physical examination, your postural exam, your palpation of the subsystem, passive, active, control. You want to talk about other associated findings related to network, for example, yield tension, eversion stress, AD or abduction stress, that type of findings. You may want to report on the dominant phase or the dominant occiput. If you had x-rays, you want to describe what was on those. The same if you send a patient for laboratory examination. You also want to describe any special material used during the assessment and review the relevant measurement literature. So for example, if you use surface electromyography, you want to describe which type of technology you used, but you also want to do a small literature review to demonstrate that this type of technology is reliable and it actually measures what you think it measures. The same thing if you use digitized posturography or any type of other objective outcomes that you may be using. You also want to operationally define or reference all variables which will be monitored, as well as describe the findings from baseline. So for example, if you're going to report on the reduction of subluxation in a patient undergoing NSA, you may want to define what subluxation means to you and how you assess for those. You want to report, for example, on adverse mechanical core tension, so you have to talk about it, define how you evaluate it, and link it to the relevant literature search that you've done. You may want to describe all the measures that will be following. So for example, you may want to say that your outcomes will be looking at muscle tone, palpatory tone of the passive system, heel tension, eversion stress, and so forth and so on. So define what your outcomes will be, define what you will be following on that patient. And then you may want to indicate a specific diagnosis. That doesn't mean you have to put a medical diagnosis, but you have to try to explain why you think the patient is not doing well and what are the causes of those. So I hope that gives you already a good start. I will see you in the next video, part 2, to continue with case report intervention and the rest of the structure.